Guru Nation, this is June 2025. We have a new FDA commissioner, Marty Makary. I thought it was important to do a book review. And rather than doing it in like one book review, I'm going to do a chapter by chapter because one of the benefits of reading this book while being in clinical research is we can read between the lines. And we may not get it from every chapter, but I think that there's a lot of information that we can kind of get from Marty Makary, as well as his head of CBER, and I think he's been nominated to a couple other things, Vinay Prasad, which probably do a similar chapter by chapter analysis of his book later. But Makary's book is called Blind Spots. And before we get into chapter one, I wanted to get through some of his quotes from the preface, which I think kind of sets the table and kind of gives you an idea of his tone. And I do not intend for this to be political. I know it might be interpreted as such because his boss is RFK, who is not very well liked by our industry, which I understand why. And his boss is Donald Trump, which is not well liked by many in the world, which I also understand. I'm not getting into political theater or commentary. I'm getting into understanding the FDA commissioner's mindset. And I think it's important for us in clinical research and also us that I have some viewers watching from the investment community and from the sponsor side. So whether you're a research site, whether you're a CRA, whether you are a biotech company, I think there's something here for all of us. Setting the table, he talks about this book, Blind Spot, is essentially where he believes our industry, and by industry means healthcare in general, has gone wrong when it comes to blind spots that we've have and that we've taken as the new normal. So his biggest thing is groupthink. He's just against this idea of groupthink. He calls it the human tendency to follow a crowd and not think independently. He believes it often creates an illusion of consensus. And he is a Johns Hopkins physician and researcher. He says, I have visited hundreds of hospitals and medical conferences around the country where I've had the privilege of meeting smart doctors who are challenging modern medicine's deeply held assumptions. He goes on to quote, humans automatically default to rejecting new information or reframing it in order to ensure that old information in the brain remains true. It's a subconscious effort to avoid the mental distress or cognitive dissonance of holding two conflicting ideas at the same time. Finally, in the preface, he says, and this is a opening to the book and to chapter one, questioning assumptions should not be viewed as a threat. It's the very way we find truth. So again, not meant to be political. I've personally always been one to question assumptions. I've been doing this in the clinical research space since I started my YouTube channel. And Macquarie seems to be of the same consensus, same mindset. So, chapter one, he opens it up with peanut allergies, and he calls it the Salem peanut trial. And his actual quote is how experts created an epidemic. So, what if I told you that one of the most devastating modern health epidemics wasn't caused by nature, but by a committee? And this is exactly what we have in chapter one of Macary's book, Blind Spots. It's all about the peanut allergy incidents. And I'm going to pull up the chart because peanut allergy incidents tripled from, and this is important, from 2005 to 2014. And I'll pull up the graphs here so you can see. Hopefully it comes out clear on the screen, but the peanut allergy incidence tripled between 2005 and 2014. This is on page 4 of his book. And in addition to that, anaphylactic reactions skyrocketed by over 20% in just 5 years. And Macri calls this, and his quote is a self-licking ice cream cone. We have dogma that justifies its own existence. So we'll get to why that is, why peanut allergy incidence in the United States, I should mention, tripled between 2005 and 2014, and why anaphylactic reactions skyrocketed by over 20% in just 5 years in the United States. So Macri begins with an anecdote, a personal story. Two African students who were, I guess, interning at Johns Hopkins are stunned when they come to the US and they realize, hey, everywhere we've been asked, we were asked on the airplane not to eat peanuts. We were asked at every restaurant we've been to so far if anyone has any peanut allergies. What's the Americans' obsession with peanut allergies? We don't have any peanut allergies in Africa. And they couldn't help but notice everywhere they've been in the US, everyone stays away from peanuts like a weapon of mass destruction. And Macquarie writes here, peanut allergies are real. My own niece has severe peanut allergies. This is me now talking, not Macquarie. And I've actually invested in a biotech, Aquestive Therapeutics. They have a sublingual epinephrine that's going to be in my opinion, this is why I invested the EpiPen kit, mainly because EpiPens developed by Mylan, which comes up in this chapter, but um, they have a compliance issue with the users don't like to carry EpiPens around with them. So Aquestive Therapeutics, and hopefully we get FDA approval. Again, I don't do anything. I don't know any insider information. I'm not affiliated with the company in any personal or professional way, just as an investor. Um, I've seen people around me. My niece has a very severe peanut allergy, and a couple other family members are allergic to other things. These are real and life-threatening. And I know when she comes over the house, we can't have peanuts around. We got to be mindful about what we have around the house. And so, how did this happen? Well, Macquarie goes on to point out in the year 2000, the American Academy of Pediatrics, AAP, recommended that children avoid peanuts until age 3. And based on what? They based it on a single sentence in a study from the United Kingdom that blamed mothers, basically. So the quote from the book is, I found one sentence stating that moms who eat peanuts are more likely to have children with peanut allergy. The data didn't actually back this. Even the study's lead author, who was a he was a Dr. Jonathan Horihane, said, it's ridiculous. I wasn't even consulted. Regardless, the damage was done, and as we go through chapter by chapter, you'll see the same themes coming up. The data didn't actually prove anything. The data didn't back it, but it became dog. And the damage was done, and pediatricians adopted the mantra 1, 2, 3. Age 1, milk. Age 2, eggs. Age 3, peanuts. This was the consensus that was adopted by pediatricians thanks to the American Academy of Pediatrics, which was based on a single sentence in a study, which the doctor's own lead author said is ridiculous and he wasn't even consulted. That leads to panic and eventually profit. And by 2004, parents were following this guideline. Peanut allergy rates exploded during this period. They were supposed to go down. In the year 2000, the AAP came out with this no peanuts until age 3 rule. Pediatricians started blindly following it. By 2004, it was clear things were going the wrong way, according to Macri in this book. In Virginia, 18% of schools banned peanuts. Parkway District in Missouri had 957 students with life-threatening food allergies by 2016, During the same time with myelin, EpiPen prices soared from 100 to 600 bucks. So Macquarie writes, Pharma exploited the situation. Myelin jacked up the price. It was price gouging the desperate. Enter Dr. Stephen Combs in rural Tennessee. He never followed these guidelines because he was trained under Dr. Rebecca Buckley from Duke, who believed in immune tolerance. Her quote from her, peanut abstinence doesn't prevent allergies, it causes them. And Dr. Combs advised early exposures, tiny amounts of peanut butter mixed with water to avoid choking, which, as a father of a newborn, I have a 5-month-old now, I'm going to start doing pretty soon. I'm going to talk to my wife about it, but we have to start introducing, in my opinion, this is not medical advice, this is from the book, introduce tiny amounts of peanut butter early on. The result of this, the quote, to this day from Dr. Combs, or to Marty Macri, sorry. To this day, the thousands of children in East Tennessee lucky enough to have Dr. Combs as their pediatrician do not have peanut allergies. So, Dr. Gideon, another doctor, Dr. Gideon Lack, noticed something interesting. He noticed that Jewish kids in Israel had 1/10 the peanut allergy rate as Jewish kids in the UK. And why? Because Israeli infants eat a peanut-based snack called a bamba. Bamba. I never heard of it till I read the book. He launched a randomized trial in 2006. The 2015 New England Journal of Medicine study showed early peanut exposure reduced allergies by 86% by age 5. And still, despite this overly convincing evidence, it took the AAP 2 years to change their guideline and another 2 for the National Institute of Health's NIAID to support it. So Macri is asking, where was the sense of urgency? Why did it take 2 years to support this? And the tragic cost, he gets into one family story. Jen and Shane had this family that he introduces in the book. Jen and Shane had a daughter named Charlie. She was born in 2009, raised with total peanut avoidance. So she was born during the peak of this peanut avoidance. She developed asthma, then a severe allergy. Even being near peanuts can trigger anaphylaxis, which again, somebody that owns Aquestive Therapeutics stock, this is something really important to the foundation of Aquestive Therapeutics. But there's a generation of kids now that have peanut allergies where Macri thinks they wouldn't have had if they were not, if the parents and the pediatricians were not following the dogma. So you have all these people saying the same thing. You just don't question that they could all be wrong. And Macri writes and points to a systemic failure. He writes to the AAP committee members, not one immunologist had written that 2000 guideline. It was mostly nutritionists. And here's a quote from a committee member. Any recommendation based on expert opinion should be taken with a grain of salt. Even today, the WIC Federal Nutrition Program, which are in charge of food stamps and assistance for low-income families, excludes peanut butter for infants despite its proven benefit. And Dr. Talal Chatila of Harvard is quoted in the book, when you push peanut avoidance as boldly as it was pushed, you end up creating a monster. Now, what's the global impact? The U.S. exported this dogma. International relief groups struggled. Macri writes, the U.S. medical establishment was exporting our ignorant medical dogma. In Africa, boiled peanut soup is a weaning of food, so they didn't have allergies. And the early observations of African relief workers were more correct than academic elites. In Africa, they refused to follow these guidelines. And even aid workers defied U.S. pediatricians. They were distributing the Bamba the right anyway, and they were right. And so Macri, this is his opening chapter. He says, "What now? He urges a national campaign, promote early peanut introduction, normalize stepwise reintroduction, and above all, humility." And this is the part that I have the biggest issue with. Since I've started my YouTube channel, I've noticed this air of elitism in our industry. And I've noticed that, I mean, it's palpable as soon as you get hired. There's always people that think they know better and they are the ivory tower and the establishments. Here's a quote from Macri. "The most unforgivable offense is when doctors make a strong recommendation not backed by data, but pretend that it is." So his final words in this chapter: "The next time a waiter asks if anyone at the table has a peanut allergy, you can thank the medical oligarchs who stormed ahead with a recommendation without doing the science." Now, this is just chapter one. I found it extremely interesting. I did not know that is the history of why there was an explosion of peanut allergies. And I mean, leave in the comments what you think about this. I could, I guess, leave my opinions alone, but you already know I'm pretty anti-establishment. And wait till you get to chapter two. Chapter two is gonna piss even more people off. Let me know what you thought about this. Like, subscribe, comment, share. I recommend everyone get the book. I'll leave it link underneath my channel. I'm not gonna get any commissions out of it. I just think everyone in this industry should read what the new person in charge of the FDA thinks about medicine, when medicine gets it wrong, and what it means for our health. And I'm hoping to get Dr. Macri, I hope I'm saying it right, or McCary on the podcast one of these days. Like, subscribe, comment, share. Bye bye.